My name is Mike Conklin. I'm the CADY Board Chair. It's a pleasure to welcome you to this, which is our 15th Regional Prevention Summit.
Back in 2011, the National Center on Addiction and Substance Abuse declared adolescent substance use America's #1 public health problem. And at that time, they could foresee the surge of addiction that has actually presented itself today, that we're dealing with in New Hampshire. That's why we have the big opiate focus today on the agenda with our speakers, and also across the country. It's something of great concern.
We are confronting a heroin and prescription opiate crisis in this country. And you all are in central New Hampshire as well. And we know we're not going to arrest our way out of the problem. We know that we need law enforcement to work collaboratively with public health. And we know there are interventions that can make a difference, such as the use of naloxone, which is really a life-saving drug. We need more prescriber education. We need our medical community to understand what dispensing some of these substances means to the community. Talk about marijuana quickly. There is a decrease in the perception of risk and harm amongst young people with respect to marijuana, and that's troubling. And we know that as the perception of risk goes down, that's followed by an increase in use, and that's trajectory is going in the wrong way. And I know particularly our young people are faced with efforts to legalize or normalize the use of marijuana, despite the science that's clear of the dangers and harms to the brain, especially the young developing brain. And our view has been, and it continues to be, that from a public health and public safety perspective, the legalization or the normalization of marijuana use is just poor public policy. We know, and I think the science is clear at this point, that substance abuse is a disease of the brain. We know that it can be treated. We know that people can recover and lead successful, productive lives. And we need to work, we need to redouble our efforts to improve our access, both in New Hampshire and in the country, to treatment. So there are two programs at ONDCP that we oversee. The first is the HIDA program, the High Intensity Drug Trafficking Area Program, which, as Deb accurately points out, provides me with this crazy long title that I even lose track of. What the HIDA is, it's a law enforcement grant program that provides roughly $250 million annually to areas of the country that have the most acute drug problem. And the premise of this program is extraordinary. It's that we're stronger when we're working together than we are when we're working alone. And that in order to get these federal resources, we need to come together, federal, state, and local, and we need to decide, you need to decide in communities what your drug threat is, what your strategy is to approach that drug threat, how you're going to use these resources in terms of developing your initiatives and developing your strategies, and then we're going to hold you responsible for measuring how you use those funds. So it's although a federal program, a program driven by the local level. We are fortunate, you are fortunate, to have in New England one of, if not our most competent, most visionary leaders of the program, and that's Jay Fallon. I know Jay's in here somewhere, who is a New Hampshire resident, and Jay deserves a big round of applause. Jay and his deputy Dave Kelly, who also is a New Hampshire resident, I know known to many of you all here. I can tell you what happens in New Hampshire, what happens in New England, eventually happens in the rest of the HIDA program and in the rest of the country. What happens here is really a laboratory in terms of what we want to do on a federal basis with the HIDA program and working with our law enforcement partners. Thank you folks for all you do, especially this morning. You deserve my particular gratitude. You do extraordinary work to make our citizens healthier and safer, so thank you, and thank you for all you do for the HIDA program. And the second program we run is the Drug-Free Communities Program. And I know CADY is very familiar with this because you receive through ONDCP and through SAMHSA over $1.25 million for 10 years. And the idea behind, and you're still involved in the program, even though you're timed out of the program, you're still helping us in terms of training and mentoring and just being fantastic partners. The idea of the Drug-Free Communities Program is similar to the HIDA in that local solutions, local problems, local solutions. And what we do in the Drug-Free Communities Program is we provide you show us a coalition, you show us sectors of the community that are working together to deal with substance abuse, and we'll show you resources, we'll provide you technical assistance, and we'll give you all the tools that the federal government has at our disposal to help you. But again, it's local solutions, local people who know the problem. You have the credibility in your communities. You have the credibility in your schools, not us in Washington. So we're very proud of the drug-free community programs. And I think, as Deb said, 10 or 11 coalitions we're funding right now in this state. So that's extraordinary. As I said, the premise of these programs are local control, but I also want to leave you with I don't want to leave you with the notion that the federal government and our office doesn't have a responsibility as well, because we do. And we have the responsibility to provide you with resources, to help strengthen your local infrastructure, to provide you on a national level with the latest data and the latest science and the latest research. We have an obligation to help formulate and help promote smart, evidence-driven policies and to provide strong national leadership and speak clearly and succinctly about the dangers of substance abuse, both in terms of public safety and public health. And you guys in this room and in this community have been great partners in allowing us to accomplish those obligations. You know, Deb also says prevention is everybody's business, and that's correct. And this community has embraced that challenge. You all have done so in an incredibly impressive, thoughtful, energetic, and I should add, compassionate way.
New Hampshire has been struggling to adequately serve our citizens. And we all know stories. I was talking over breakfast. This has been my experience with Alzheimer's, but it's equally true in the substance abuse arena. This is not an illness that you choose. This is an illness that chooses you. And what we're seeing right now is the crossover into every corner of our state, every sector, every element. There are no socioeconomic boundaries to this. Everyone is impacted. Our friends, our neighbors, our coworkers, our children, all of us know that families are being torn apart by addiction. These stories are harrowing, what people have been through. As I talked to law enforcement, I heard a story just last week. Every week now I'm hearing more and more stories, but working down in Rockingham County. And it is great that we now have this medication that we can stop, prevent a death. But they have a young woman who is so addicted that they have used this 8 times. And what is the future for her life and for our community? I've heard of an overdose leading to a death of an elementary school teacher with 3 children. I mean, these are not other. These are not people that are away from us or different than us. These are people that are deeply embedded in our families. A sweet story, but a heartbreaking one. A friend that I've met through being involved in politics, she's actually the person that when I go on television, she's the one that gets me all done up. She's a wonderful, wonderful person. She's actually done this. She has an extraordinary life story because she went on the road during the presidential elections, and she has made up Hillary Clinton, Barack Obama, Bill Clinton. I mean, she knows all these amazing stories. And recently, over the month, she was telling me the troubling story of her stepdaughter, who's now lost her life. And she said heroin takes people away from all of us, takes people from those we love. No matter how hard they tried, no matter how much they tried to access treatment, she finally just left a note and said, I'm going back to my people. And so we all need to pull together. We've been having roundtables and forums all across this district. Last year, we were over in the Claremont area dealing with drug addiction in pregnant women and what that's doing to their community with babies that are being born with addiction. I've been working with physicians across the state. I just had an extraordinary meeting 2 weeks ago up at the Veterans Hospital in White River Junction, where they're doing cutting-edge research on bringing down the use of opiates and making sure that they have drug and alcohol treatment. If you know veterans that need treatment, we have an outstanding program. It's actually embedded in their mental health program, and it's really cutting edge for the whole country. Last week, you may have heard, we did a mental health summit with over 100 people meeting. Thank you, Tim, and others for joining us, meeting in Concord. And all throughout those 3 panels was the conversation about co-occurring illnesses. I've had the opportunity in my previous legal life to work for 25 years with Dartmouth College and the Department of Psychiatry and the New Hampshire Hospital. Incredible man there named Dr. Alan Green, whose research and specialty and expertise is in this area of co-occurring illness with substance abuse disorder combined with mental health issues. We had the commissioner, we had everyone at the table, and I'm going to continue to do this, convene, bring people together, and then try to find the funding to support all of you that are out there doing this work on the front line. We need our healthcare systems, our providers. We're seeing an unprecedented number of patients coming in to meet this demand. Our correctional facilities are seeing their units filled with individuals who are non-threatening but struggling to manage debilitating addiction. And often these patients are released only to return to prison within weeks, sometimes within days. This police officer that I was meeting with at the memorial down in Washington last week was begging me to recognize, and I recognize, begging me to share with my colleagues so that my colleagues will recognize that this issue cannot be treated with arrests, that we need treatment, that we need services, that we need a place for people to go in our community to get well and to get better. And right now, we need to figure out how to bring this all together and reel this epidemic back in. Science has proven that substance abuse and addiction are diseases of the brain. And the experience that my family went through with Alzheimer's disease, people would frequently come up to me and say, "How did this happen to your mother?" And I would say, well, it's an equal opportunity illness. We did not look for this. She did not choose this. But I think it's very similar with addiction. We, just as a society, as a philosophy, it's deeply embedded in our DNA that we believe in choice, freedom of choice, that people make choices, that young people make choices. And I think what we're learning more than anything else through this opiate and then heroin addiction issue is that these are people begging for cure, begging for treatment. This is not a choice. You don't wake up in the morning when you're trying to raise 3 children and go off to be an elementary school teacher to choose to be addicted to heroin. This is something that is going on with the brain, and I'm hoping that the science and the research will catch up so that we can all understand that and that everyone in our society can understand that and help to deal with that. But this is not a choice. These are not the result of a moral failing, and they must not be regarded as such by peers or professionals or families, because I think that is a barrier to getting the help that people need. It's a barrier for families, and it's certainly a barrier within our community. I've dealt with this as an employer. I've dealt with this as a colleague. I was 25 years working in a law firm with a group of wonderful, wonderful people. And what you learn is that people have challenges in their life. We all do. I've dealt with this in my family. I have a nephew with late onset schizophrenia, and this is a result from drug use in his teens. This is very, very challenging. It's a lifelong illness for him. And so I think what we need to do is face this formidable task of looking deeper in hopes of discovering what's behind the growing epidemic here in New Hampshire and figuring out how we can work together to stop it.